Hi, everyone. Thanks for joining us. We're going to give it about 30 more seconds or so until we start, just to let people join the webinar. But thanks for joining. Okay, welcome everyone to AEP Vermont's webinar, Protecting Young Vermonters with COVID Vaccine. We're so excited to have you join us, and happy to have a conversation and have your questions answered about the COVID-19 vaccine for young children. So I'm going to introduce myself. I'm Dr. Becca Bell. I'm a pediatric ICU doctor. I work at the University of Vermont Children's Hospital, and I'm an associate professor of pediatrics at the Larner College of Medicine. And currently I'm the Vermont chapter president of the American Academy of Pediatrics Vermont chapter. And I'm really excited to introduce Dr. Stan Weinberger, who is a pediatrician at University Pediatrics in Burlington, Vermont. He's a medical director there and also an associate professor at the Larner College of Medicine. And I'm going to hand things over to him in a second. I just want to let you all know that the plan for tonight is Dr. Weinberger is going to present some information to you all. It will take about 30 minutes. And then afterwards, we are going to do a Q&A for however long it takes. Usually this goes a little more than fully an hour, but it just depends on your questions. You are welcome to go ahead and put your questions in the Q&A section, and some of your questions may be answered during the presentation, but we're happy to kind of come back to it and make sure we've answered that to your satisfaction. If there's a lot, just if there's a lot of questions that are on the same topic, I may kind of like put it together and ask Dr. Weinberger the question. So hopefully the topic will be covered. And this session is going to be recorded and then put up on our website for later viewing. So if you find this to be helpful, you can come back to our website in a day or two and then share with other folks, friends and family. We would love that. I want to take a special moment to recognize Nicole, who is our ASL interpreter for the evening. Hopefully you all can see her pinned to your screen. Please let us know if you're having any trouble seeing her, and we really appreciate her being here, and for the Vermont Department of Health for collaborating with us on this effort. So with that, I'm going to turn things over to Dr. Stan Weinberger.
There we go. Found out how to unmute myself. Thank you. Yeah, I'm really excited to be here. I really enjoy talking to families and parents about all kinds of stuff, vaccines included. I think, this is a really important topic. And I'm a pediatrician, I'm also a parent. And, we've all been going through this like we should, right? When there's new illnesses and new treatments and new vaccines, trying to gather information about what's out there and how to make the right choices for us and our families and our kids. And so we'll kind of go through all of this. And yeah, I definitely invite your questions. We'll kind of cover a whole bunch of questions, right? Why vaccination? What's behind that recommendation? What are the vaccines out there and what are their differences? A little bit more specifically about risks and benefits of the vaccinations, and also a little bit at this point, COVID's been around for over 2 years, and many folks have already had COVID before. So what then? And do we still recommend vaccination? You probably have seen this, right? But the CDC, and this was in early June, approved 2 COVID vaccines, for kids down to age 6 months. And the recommendation, and this is included by the Vermont AAP, or American Academy of Pediatrics, and pediatric medical professionals in general, as well as family medicine professionals, that really all kids ages 6 months and above get vaccinated. And myself and my partners here at the Vermont Children's Hospital share that recommendation, really, regardless of whether you've had COVID before or underlying health conditions. So we'll get more into what's behind that recommendation. Just talk a little bit about how COVID vaccines work. And for some of this, this might be totally well known to you all, or for others, this might be more helpful. But in general, COVID vaccines work similar to all the other vaccines that we have, be it from measles and chickenpox to tetanus. They work by the pathogen, virus or bacteria. In this case, it's SARS-CoV-2, the virus that causes COVID-19, gets into the body and multiplies inside the body. And what vaccines do is that they present information to your immune system so that it can make antibodies, which are proteins designed to fight illnesses, in this case, the virus. And so what happens after vaccination is your body is essentially prepped for this, so that when COVID-19 or the SARS-CoV-2 virus comes along, your body is ready and can fight off that infection. And so that has two roles, really. One, it tends to make it less likely that you'll get infected at all or have any sort of symptoms from infection. But really importantly, it's effective at preventing serious disease. And that part is important. There's a lot of vaccines out there for different things, particularly childhood illnesses. And while many of them do a great job protecting against the disease, what vaccines are really designed to do is prevent people from getting really sick, hospitalized, and death. And so that's really the main important thing. And the COVID-19 vaccines, both the ones for this age group as well as for older age groups, do that really well. And we'll look through some data. They do also provide protection against any kind of symptomatic disease, but not perfectly. The other reason to consider vaccinating, right, is that we know that you can, once you've had COVID, you can get it again. Unfortunately, the protection that you get from having had COVID doesn't seem to last that long, and doesn't seem to hold up very well as COVID changes. And the vaccine actually seems to produce somewhat longer lasting and more effective immunity or protection. So we'll get in more about safety. Oops, and I might have jumped ahead a slide. I will say, we have a lot of information about the COVID vaccine, both the trials that were done in each age group, as well as, all the data that's happened since the trials. And there's a lot of monitoring out there. The CDC talks about this being the most intensive safety monitoring in history. And it really is. You may remember, if, those of you who got COVID vaccines yourself, you could do your own kind of reporting called Be Safe. There is also an adverse event reporting system for all vaccines that's been around for decades and decades. And then there's a passive monitoring. So we know a lot of information. And I think back to when the Johnson & Johnson vaccine came out, right? A pretty promising vaccine that we hoped would be really helpful. And that vaccine actually was paused after like 6 adverse events amongst millions of doses. And so I think it is really helpful. I do find it's encouraging to me that actually we collectively across the country, right, can find pretty rare things and act on them pretty quickly. So we'll talk more about that. Both both vaccines that are approved for kids 6 months through 5 years of age there's two, the Moderna vaccine and the Pfizer vaccine, and they are both mRNA vaccines. So that stands for messenger RNA. What messenger RNA is, it's you can think of it sort of like a recipe book. It sort of gives instructions to the body to make proteins. And so in this case, it's a piece of mRNA that gives instructions to make a spike protein that looks like the spike protein from COVID. And so your immune system then recognizes that protein, makes antibodies against it, so that when you're faced with a real COVID infection, you can quickly ramp up and fight it off with those antibodies. The important thing to know about mRNA is it dissolves really quickly, like within a day or two. And so the actual vaccine material is out of your body quite quickly and doesn't actually interact with any of your own genetic material. So so far, and I guess we were talking about, right, how do we know what we know? These vaccines collectively for, older age groups and adults, there's been over 580 million doses in the US, as well as millions and millions of doses in kids. And so that's a lot of power. We also have the clinical trials, and we'll get into the clinical trials a little bit. So they were done for both Pfizer and Moderna. And for both vaccines, they included kids who had COVID-19 infection and those who had never been infected previously. And they also include kids both with and without all kinds of different underlying health conditions. And that's important, right? We know that kids come in all sizes and shapes, and they have all kinds of prior experiences, right? And we want to know, does this work for, my child and their particular experience? So side effects, in a few slides later, we'll get in, to the actual data from the trials, so you can see that. The side effects largely are, similar to what adults experience. We got the COVID vaccine, although they tend to be less, in particular because it's a lower dose. So you see some local reactions, right? Like pain, redness, swelling where you got the shot. There's some fatigue and irritability, a little bit of fever, but generally at a much lower rate than adults. And those side effects are temporary. So we'll go through first the Pfizer vaccine and a little information about that and how that was studied. And then we'll go through the Moderna vaccine. So the Pfizer vaccine was approved for 6 months through to your 5th birthday. And it's a 3 microgram dose. Pfizer already had a vaccine approved for the older kids, 5 to 11, which was 10 micrograms, and for the 12 and above, which is 30 micrograms. So this dose is a 1/10 of a dose that older teens and adults got. And what they looked at was the immune response. And so they were looking to get the same immune response in those young kids as the 16 to 25-year-olds got after their 2 doses. It's important to note, I'll talk about the trial. There were no serious adverse events in the trial. So they looked at, it was control trial. So who, and some people who are getting 1,500 who got a placebo. And they, as I said, the goal, it was powered to look at, they were looking at the immune response. And it took 3 doses in this vaccine. I should say the reason they picked the 3 microgram dose was way back in the first stage because it seemed to initially do okay, but also have fewer side effects. So we're going to look at just what the side effects were that they found. And so this is data for the kids aged 2 to 5. And so you see, looked at a whole bunch of different symptoms: fever, fatigue, headache, chills. And they looked at, after each dose, and they compared them to both getting the vaccine and then placebo, so not getting the vaccine. And you could see that, about the seeing in particular was that it was very similar between placebo, the actual vaccine. So we're seeing some
Dr. Weinberger, I'm gonna interrupt for 1 second. Sorry to interrupt your presentation. Your internet's a bit spotty, and so I wonder if you are able to actually call in with your phone, just so that the audio.
So really, they're looking at fever.
We're gonna send you the number to call in, and then your audio will be more consistent. And you can keep your camera on, but I think that would be helpful to have just consistent audio, just because you're coming in and out. And I'll just take a moment to say, while Dr. Weinberger is calling in, that we've already gotten some great questions, and so that's really awesome. And we are spending some extra time on the side effects question, which is, it seems like a lot with the slides and the data and the graphs, but this is the thing that parents ask us a lot about, is like, what are the side effects? What can I expect? And just give me the thumbs up, Dr. Weinberger, when your audio is all set, and I can stop chatting. But really, we're going into the details because parents are asking, and we want to make sure you have all the information that you need. But the long and short of it is that what we're seeing really is something similar to what we see generally with childhood immunizations. So that kind of local reaction, like some soreness and some redness. And then we are seeing fewer systemic side effects than we see with adults. And I can say that happened with my own family. Like, I definitely had more sort of chills and feeling kind of unwell the following day after I had my vaccines, compared to my kids who are very young, who got the vaccine. And we think that has to do with just the amount of mRNA that was included. And as you saw, they were decreasing amounts compared to the adults and even sort of the adolescents. And so we know that young kids just need their immune system needs less prompting to really have a response. Those of us who are older need a little bit more prompting. And so the vaccine scientists really did a good job in trying to think, like, what is the lowest dose we can give so we can still have an immune response, which is what we want. We want the immune system to respond and to be ready for a future exposure. But also, we know that we're talking about 2 or 3 shots, and we want kids to be still feeling well after them. And so as pediatricians, we've noticed that kids actually seem to have fewer side effects than adults when we're looking at this, and really no serious adverse events during the clinical trials, which has been helpful. And we've been giving our children, our adolescent patients and our school age patients, this vaccine for a long time and have had really good results with that. So it looks like, thank you all for bearing with us. Dr. Weinberger is joining by audio. And I think we're going to try to get the slides back up so we can go back to talking about side effects. But we wanted to spend some time on this because this is like a big question from families, or what sort of side effects do we expect? Okay, it looks like I see your audio there. So it looks like you're probably probably back. And then I think we have our wonderful executive director of our chapter, Stephanie Winters, who's joining us, and she might share the slides so that we can, minimize Dr. Weinberger's bandwidth there. There we go. Okay.
All right.
Get back to you.
Awesome. Thank you. Yeah, exactly. So I think, right, by and large, one of the key things that, everybody asks me are, what side effects shall I expect? Thank you for bearing with me. Okay. So the Moderna vaccine, very similar, lower dose. They chose the dose, and it's not exactly comparable, but it's 1/4 of the dose of what the adults get. And again, they were looking at the same thing. What's the immune response compared to young adults and teenagers, because we know that it worked well in those kids. And they saw no adverse events related to the vaccine. So again, they looked at similar numbers. They had 5,000 kids who got the vaccine and 1,500 who didn't, who got placebo. It was designed the same way. And so, so we saw, and they measured the same things, and they saw similar things: headache, fatigue, very similar between the vaccine and placebo. This looks at kids who are 3 years old to 5 years. And this looks at the younger kids, toddlers, 6 months through 3 years of age. So we saw more irritability in the young kids. So one question that we've been seeing a lot, is what about vaccine-associated myocarditis? And this is important to bring up because we know that, this is, again, one of those cases where, as the vaccine was being rolled out in 12 to 17-year-olds, 12 to 17-year-olds, there was a slight increase in myocarditis, which is an inflammation of the heart. And that turned out to be a pretty rare side effect, but it was, I thought it was very impressive how quickly they picked up on that. And it's important to know that we see myocarditis in the community from all sorts of reasons. So it's not very common, but it's around, and it can be tricky to sort of figure out, am I seeing a few more cases of these than we would normally expect to see? And is it related at all in timing to the vaccine? And so we know now that, yes, there is an increased risk. And in particular, it's in teenage boys. The biggest risk is around 16 and 17, and it seems to be after the second shot. And it's extremely rare, about 1 in 10,000. But it's helpful to know because they actually, when they were looking at studies for younger kids, they looked specifically at that question. So that was one of the things when they looked to see how many kids should we enroll. They were looking to see if they could pick up any incidents of that. And there was no cases of vaccine-associated myocarditis in the trials. So, and this just kind of goes through that in a similar question. No cases occurred. And as to why that is, interestingly, there seems to be something about teenagers that's different. It has to do a little bit with myocarditis in general. But also, we're using lower doses of the vaccine for these kids. I think it's important to talk about myocarditis related to COVID. And in particular, because one of the things that COVID infections do is cause myocarditis. And that's not that unusual. There are many viruses in particular that cause myocarditis. And so we're seeing that with COVID. And you are more likely as a child to get myocarditis from COVID itself than from the vaccine. And in addition, it tends to be more severe. And so it is helpful to know, I know we talk a lot about vaccine-associated myocarditis, but the infection itself is more likely to cause myocarditis and more severe. So I think that's just whenever we're thinking about risks and benefits, right, as we do. So what about late onset side effects, right? I mean, this is the other question that comes up, right? How do I know this vaccine, the first doses were given in December of 2020, right, to the general public. And so it is a relatively new vaccine. How do I know there's not going to be later stuff? And it is helpful to know that no new side effects have ever been documented more than 2 months after vaccination. And that's actually in the history of vaccines. That's just period. And while these vaccines are a little bit different, they're also not really that different, right? In general, they work in the same way as other vaccines by presenting, helping the body make antibodies to something, to some infection so that they can prevent it. And we know that mRNA gets out of your body quickly. So while, there's ongoing monitoring, we really haven't seen anything, nor do we expect to see anything, beyond what we're seeing. So what about COVID, right? Because that's the other question that comes up. How risky is COVID actually for 6 months to 5 years of age? I think we all know that the older you are, that certainly increases your risk. So we'll just talk a little bit about that. And this looks at hospitalizations. There's a couple ways to look at that. One is hospitalizations. Young kids are a bit more likely to be hospitalized. That's actually for a couple of reasons. One, they tend to be a little bit more likely to get dehydrated. They tend to have some more respiratory symptoms. They can develop croup or other things related to the virus. So we see a bit more pneumonia in that age group. Also, you can see that as we get later on in this graph, more of the older kids were vaccinated. And so it's not surprising that there's more, young kids, because they're the ones who couldn't be vaccinated yet. So it's just more about pneumonia. I was going to say the other kind of, thing that we worry about with COVID is multi-inflammatory syndrome in kids, where having a COVID infection just kind of causes this cascade of inflammation throughout the body and can affect lots of different organ systems, including the heart, and cause really severe illness and death. And across the US, there's been about 8,000 cases and 70 deaths. And so that's another thing that seems to be most prevalent, not in this really young age group, but more in the 5 to 11 age group. So this just looks at, the number of cases of MIS-C. And then, I think the other thing we can look at is, right, just those most severe side effects. We hear a lot about, the over 1 million deaths of COVID. Thankfully, right, pediatric deaths have been much, much less frequent. In fact, I believe in that 0 to 5 age group, there's been about 200 deaths, maybe just over 200 deaths, which is thankfully much, much less. It is, I think, like 1.5%, almost 2% of all deaths in that age group, though. So it does work out to be about the 4th or 5th leading cause of death in that young age group, which is important to know. One, young kids, they are pretty resilient and they don't usually die from infections. And so that's one of those things as I think about, okay, and my computer seems to be sluggish in terms of now that I'm on dual things, turning the next slide. What are the risks and benefits? So couple other questions. How do I choose between Pfizer and Moderna? Oh, Vermont. We had incredibly high vaccination rates in Vermont compared to other places in the country. And so we have seen, in Vermont, things have been a bit different than in other places of the country, thankfully. So what if my child's already had COVID infection? And that's an interesting question. At this point, they had released some seroprevalence data. So something like 70 to 80% of all kids, slightly more in the teens and older kids and slightly less in the younger kids, but have been exposed to COVID at this point. And so some with symptoms, some without, some who never knew it. And so, doesn't that protect you, right? It turns out less than we would hope. And I think we've all been hearing cases of people who, got COVID and then got COVID a second time, right? And it turns out in particular, when you get COVID, it provides some protection, but as COVID itself mutates, it seems to override that. So how long are you protected after you've been infected? It's probably really different for each person. It seems like maybe 3 months. I thought this was interesting information, right? This has been studied, and it does look like, one, vaccination provides longer protection. It also seems to provide more broad protection. That is, it seems to hold up a little bit better as COVID changes, right? And so that's important. It seems to be a more durable response. Now, it's not forever, and we know that, right, for adults and teens and now kids, most groups they're recommending boosters after about 5 or 6 months. And, what's that going to look like in the future? I don't know. COVID seems to be a disease that changes, right? It evolves over time, and it doesn't seem to be going away. So I do wonder if this is, one of the other things we have a lot of familiarity with that does that too is flu, that changes over time, where we have a vaccine that really prevents serious illness, but it requires a booster, right? Your annual flu shot, and COVID may very well be quite similar. So what about after COVID-19 infection? It's recommended that you still vaccinate, even if you've had COVID. And it does seem to be safe to vaccinate, literally as soon as you've finished your isolation period. So that could be on day 11. But, it's also okay to wait. What's the right amount of time to wait? Up to 3 months. But, this is an area where there is not a lot of information out there. And so that seems to be a reasonable answer, but it is not true. Each person will have their own immune response after getting sick with COVID. So another question that comes up all the time, right? How did they pick these ages and these doses? And why isn't it based on weight, right? Some 11-year-olds might be quite large, and other 12-year-olds might be quite small, right? Like we dose other things. And the main reason is that vaccines are not medications. And so, you're not trying to get a certain amount of medication per size of body. It's really based on your immune system responsiveness. And in general, young kids respond more, their immune systems respond to the different things they're seeing in a much more vigorous way. And so now they have picked cutoffs, and so it is true that if you are just before your 5-year-old birthday, you're not going to change dramatically, from one week to the next. But it is true that for kids, they often need less. It's based on that maturity. So what about other vaccines, right? Kids, particularly in this age group, there are other routine childhood vaccines, and it is fine to get the COVID vaccine with any of the other vaccines. And, we do recommend staying up to date on all those other vaccines. And in this, throughout COVID, for all age groups, they've been co-administered with other vaccines, and that has not caused a problem. So where can you find more information? This is a good, healthychildren.org is a great wealth of information from pediatricians, from the AAP, both about COVID vaccines, but a ton of other stuff about your child's well-being and health and growth. So that's a great place to check out in general. How's it going so far? So specifically for kids under 5, as of last, I guess this is 2 weeks ago, there's been over 800,000 vaccines given in that age group in the US and about 5,000 Vermonters. Most of them have been done in their kids' pediatrician and family medicine offices, and it's about half and half between Pfizer and Moderna. So where, if you're choosing to get your child vaccinated, the best place to check is with your child's doctor. And that's a great place to turn to in general. I mean, I know I speak for any of my colleagues that we're happy to talk about this, answer any questions, help, provide whatever guidance we can to help families just feel comfortable with their decision and make sure they're understanding, these important conversations. The Department of Health has some walk-in clinics. And so that's a great place to check. Some pharmacies do, but the other great place to check out is WIC. So if you're a WIC client, they have vaccine too. The Department of Health, that's their webpage, which you may have been to at some point during this COVID pandemic, but they have a host of different clinics, and that's where you'll find that. It's just an example of what you'll see. How about questions?
Yeah, thanks so much. We have a bunch of good questions. Thank you for that, all that info. I'm going to jump straight to a very practical question, and one that we get every time we do one of these, and I'm sure you're getting in your office, and that is, okay, families interested in vaccinating, but we also know that there are studies ongoing of new bivalent vaccines. So that would include protection against Omicron. So how are you recommending families kind of handle that situation? And this particular attendee is asking, do you have any information about the next update to the vaccines that could offer more protection against BA.5? And really it's Omicron in general. I'm adding that. When can we expect to see that update for children, both for the under 5 and older kids? And this family is trying to figure out, so there's sort of two things: when to boost a 5-year-old, so a kid in the 5 to 12 who might be eligible for a booster. How are you helping families navigate that question about when to boost? And then if you have a 3-year-old who's ready to be vaccinated now, how do you suggest getting vaccinated now? Do you wait? How do you think about these potential upcoming new next generation of vaccines?
That's a great question. And, and unfortunately, it's not a question for which there's a perfect answer, right? That we know. It is exciting that they are coming out with these bivalent vaccines. And right, this is very similar to the way that flu vaccine works. That's a quadrivalent vaccine. So it's got 4, and it, is updated on an annual basis, looking at what is the most likely types of flu that are coming through. And so this is a great development, and it sounds like there will be something ready for some of the population in the fall. In general, with kids, it is tricky, right? It took a long time to get this particular vaccine. And so in general, we've been recommending, to get the vaccine when you're able to, because it's not exactly clear when, even if a bivalent vaccine comes out, when it'll be available for kids. That being said, I do believe Moderna is testing a third, booster dose of a bivalent vaccine for kids under 5. So there may be some data around Moderna for, actually this age group of young kids sooner rather than later. But, and there's no right answer. You're also juggling. We know that as kids get indoors, as school starts and the weather gets colder, although it's impossible to predict, it would not be surprising to see an increase in cases of COVID. And so, right, looking ahead to that, the general recommendation is, get it while you can, while it's available. It's hard to really strongly say wait.
Yeah, I guess I would add that for me, I think about, and I don't know, Dr. Weinberger, if you feel the same way, that the primary series to me is a little different than the booster. So for me, I feel like getting that primary series and that foundation down of immunity that we know is pretty broad against severe disease. If I had, in this case, this is say like a 5-year-old and a 3-year-old, I would go ahead and start the 3-year-old getting vaccinated with that primary series, whether Moderna or Pfizer, either one. I think once you start becoming eligible for the booster, there are different ways you might think about how to boost, because the boost is really giving you that extra neutralizing antibody, which will protect you from infection for some period of time. And then we sort of know that wanes. So for me, I'll share, just because people like to sometimes hear anecdotes, that I had a young child who wasn't eligible until the summer to get vaccinated, and I started his primary series. And I will get my other child boosted before the school year starts, because I feel like that, as Dr. Weinberger pointed out, you're inside more, and we wouldn't be surprised if we see more. The timing is really challenging. The Moderna is testing they're testing a third dose right now, and part of the clinical trials are including, even in the young kids, like this bivalent vaccine, which is awesome to include young kids this early. I suspect, though, that even if, say, we hear from the CDC that this Omicron bivalent vaccine is available in September, I think we're going to start with the most vulnerable, like older adults. I wouldn't be surprised, and this changes all the time, if young kids aren't really eligible for that Omicron included vaccine until like way at the end of the year, like maybe November, December. And so I wouldn't expect that young kids would be eligible for this vaccine in September, if that helps with people's planning. And I really think about the school year, trying not to be like getting ready for the school year. And so I would personally say I would start the primary series for sure. I would even get boosted now to prepare for the school season, and knowing that probably the Omicron included vaccine probably won't be available to young kids until the winter. I don't know if you have other thoughts on that.
No, that's very similar. And I have 2 children. They're not in this age group. They're in the 5 to 11 age group. And we did, hem and haw, and got them boosted. We got them their primary series right away. And then, as we came to look at boosters, people were talking about waiting, but we realized that, we didn't want them to get COVID over the summer. We had some immunocompromised people. We were relatives that we wanted to visit and see, and we did the booster pretty much as soon as, they were eligible for that. But, I have colleagues who are doing something slightly different, waiting a little bit closer to the school year. I don't know, you're like Dr. Bell said. Yeah, but the primary series does provide that base protection against severe disease that does seem to carry across the different strains. Great question.
Yeah, I have a bunch of great questions. So the next question, I'm sure you're getting this a ton, is okay, a family's ready to get vaccinated, Moderna versus Pfizer. And specifically, the question here is about efficacy. So you
Mhm.
talked a bunch about in your slides about side effects, but what about efficacy? Like, do you have a sense of which one just works better?
Yeah, that's a great question. Not particularly. So, uh, and part of that is from small numbers, right? So both seem to provide really good antibody levels. But when you start to look at like real world cases of how do they perform against getting sick, there's much less, and this is true of all the vaccines, right? Like when they first came out, there were like 95% against getting COVID. It was astounding. And then as you started to get all these different strains, right, they lost a lot of that effectiveness. And so Moderna, they reported something like 50% effectiveness. Pfizer reported a little bit more, but it was on like such a tiny number of cases. Really, you wouldn't hang your hat on that. So it's hard to know exactly if one is slightly more effective at stopping any symptomatic disease. I will say, right, the Moderna vaccine gets you there faster. The Pfizer vaccine really, the protection was not as good after the 2 doses, and so you need that 3 dose, which is 8 weeks after. So yeah, we tend to think of them as somewhat interchangeable. It's hard to say one works better than the other.
And going along with this, so the Moderna Pfizer question, and this is another super common question, is what about mixing brands? And
Yeah.
is that safe? So the question really is about safety, one, but maybe I will also add just talking about what the recommendation is. So I'm going to read the question.
Sure, yeah.
In the future, would it be safe to mix brands? So if my child got Pfizer, could they then get Moderna booster, especially, and this is the question, if one or the other comes out with the bivalent vaccine versus the other?
Great question. And that's an area where, it has not been studied in this age group, right? There are adults who, because Pfizer and Moderna were both approved early on for adults and where people have had mix and match, but there's really no data in this age group. So the recommendation is, stick with a brand. Now that could change as boosters come out, but for your primary series, stick with the brand. They do say, and this is true, for other childhood vaccines, there are different brands of vaccine, for the tetanus vaccine. And the general recommendation is stick with a brand. But if you really need the vaccine and there's only the other brand, to not wait to vaccinate. So that's general vaccine guidance. The one caveat that's very specific to this, right, is that the Pfizer vaccine's 3 doses. And so, if you combine brands somehow, you would really need a 3-dose series because you'd have one of the Pfizer doses in there, and so you'd want either 3 doses, 2 of the Pfizer and 1 of Moderna, or at least 2 Modernas.
Right. So if you start with, or if you get a Pfizer as part of this under 5 series, you really need 3 doses of a vaccine.
Correct.
Even if it's mixed and matched. So yeah, so whenever we're asked about this question hasn't really specifically been studied. We don't have any reason to think it wouldn't be safe. You're asking about safety, but sticking with what's been studied is always what we're going to recommend, as physicians, but also understand that we want people to be vaccinated. And so if there's only one vaccine available, we still recommend going ahead and doing that, just understanding if one of them is a Pfizer vaccine, then you're going to need 3. So what do you say at this point? Everybody has either experienced themselves or will say, I know somebody who's been vaccinated and they got COVID. And I know you addressed this a bit in your slides, but like, how do you, when you're in the clinic and you're talking to families, like, how do you help them think through that? Because it seems like we hear about we have some vaccines where you get the vaccine and like you're never going to get the infection, right? So when we think about things like, you know, the measles, or you brought up tetanus, or some of these other diseases, and then we think about like the flu vaccine, which is oftentimes a different conversation. We recommend the flu vaccine every year, but sometimes people can still get the flu. So how do you have this conversation with families? Say, I know somebody who got, or I myself got vaccinated and I got COVID, so why should I vaccinate my child?
Right. Yeah. And I think, that's a totally fair question. I do think it is very much like the flu vaccine. We know that, and so it is, the COVID vaccine will provide some protection against, you're less likely to get COVID. And that's great. Nobody wants COVID, even mild cases of COVID. However, we, what we really don't want is severe disease, and they do protect well against that. And it's always hard to know, right? Like if I myself was vaccinated, and as was my son, and both of us got COVID in January. And would I have been more sick? Maybe. I don't know. Luckily, I wasn't that sick. It wasn't fun. But I do still, try and remind myself and others that what we should think about this similar to the flu vaccine, and that what we really want to do is prevent hospitalization and death from COVID. So that I mean, I think is important there. The other thing I think that I just sort of think in my head when I'm thinking about risk and benefit, this vaccine is proving to be incredibly safe. The risks of the vaccine are quite small. The risks of COVID are kind of unknown. We know about some things, MIS-C, that multi-inflammatory system. We know about, pneumonias and hospitalizations. There's, long COVID, which seems to be much more common in adults. We know virtually nothing about it in kids. And it's a weird disease that causes a lot of different things. And that are unknown risks about being sick with COVID that the vaccine doesn't seem to have. And so I do think about that as I think about, okay, how do I go about these decisions?
It's like always weighing risks and benefits, right? That's kind of how we have to come about making our recommendations.
And as parents, and it's tough as parents, but there's no better person to be doing that than you as a parent. And so we want to support you and your knowledge gathering and your decision making, and we appreciate your trust.
Are there any, speaking of risks and benefits, are there any sort of category of patients where you would recommend not getting vaccinated? So a lot of times we have sort of two questions that families ask us. One is, my child is healthy, they have no medical conditions, would they still benefit from the vaccine, or would you recommend not getting vaccinated? And then similarly, we also get questions from families saying, my child has a heart condition, or my child has asthma, or my child has epilepsy and seizures, so they have an underlying medical condition. Do you think they should get vaccinated or not? So how do you think about that with your patients and knowing their medical history? Are there ever times where you would recommend not getting vaccinated?
Yeah, that's a great question. And to my knowledge, there are not. I know, and we've had these discussions very specifically with the, cardiologists, because there was the concern around myocarditis. And for all their patients with, congenital heart disease, they recommend the vaccine. There is, and to my knowledge, there's not other groups of patients for whom the vaccine is, we would say, no, you should not get this. I don't know if you know of any Becca, but
No, I don't. And I recommend all of our kids with any type of underlying health condition definitely get vaccinated, and then healthy kids too, because again, you had mentioned that the risk is so small that the when you match up that risk and benefit, it's always, in this case, in the case of the COVID vaccine, the benefit outweighs the risk. And we just don't know. We do see some healthy kids get really sick from COVID, and we just don't know who those kids are going to be. Like, you can't predict that ahead of time. And same thing, I'm a parent of young kids, and that's how I thought about it too, is that the benefits really outweigh the risks. Yeah, one more question is, what do you recommend parents prepare for their kids getting vaccinated in terms of, you talked about the side effects, and it seemed like pretty low. Should they plan that their kid's going to be at a daycare the next day, that they might have to miss work? What are you seeing? So it's been about a little over a month since you started vaccinating this age group. What are you sort of hearing from families about how they're doing with the vaccine?
yeah, not much. I mean, most kids have done really, really well. And I mean, when you think about the data, it was maybe 20%, like 1 in 5 kids was fatigued, and maybe 1 in 20 kids had some fever. And by and large, that was, pretty low fever. There was, very little high fever. And so, I mean, yeah, we, sort of prepare that they might feel crummy, but probably they're not. Most kids don't.
It's
And in
probably hard.
general, sometimes parents ask about, should we pre-treat with Tylenol or things like that? And I always say, generally not. If your child is uncomfortable, by all means, that's okay. We don't want them to be uncomfortable, but most kids aren't. They do fine.
I think we got to all the questions. I'm going to give Dr. Weinberger a moment to give his last thoughts. If anyone has any other questions they want to put in, we're still happy to answer them. But I just wanted to thank folks for joining, asking their questions, and wanted to hand things over to Dr. Weinberger to just kind of give your last thoughts on how you're thinking about this vaccine.
Sure. Thanks for standing with me through the room changes and technical snafus. Yeah, I mean, this is exciting. I think it's important that kids of all ages have access to a safe COVID vaccine, right? I mean, we've been at this for 2 years, and it has been horribly disruptive to families and to kids and their, social and emotional learning. And so to have a vaccine is really important. And this vaccine seems to be incredibly safe, and provide really strong protection against severe disease. So I'm excited about it, and confidently recommend it. And I also know that as a parent, whenever we're faced with these decisions, my role is just to partner with parents, and so I appreciate any questions or concerns you have. And I know you can whoever your child's doctor is, you can reach out to them, because you're the best decision maker for your child, and we want to support you in that however we can.
Thank you so much. I think I heard your pager go off. So, or I don't know if I'm just imagining that, but I thought I heard a pager go off. So
I think that was my wife's.
Your wife. Okay. Thank you again. As a reminder, this will probably by tomorrow, we'll have this recording up. We have one from last month as well. Please feel free, for those who want to share the recording, go ahead and share that. And we're going to have another session at noon on Wednesday with a different pediatric provider, because we're just trying to find good times for, for me, this is always a good time because my kids are in bed around 8. Like people always try to do stuff at 6 and 7. It's really hard for kids, parents of young kids. But so for those who have time at noon on Wednesday, we're going to do another session too. So please spread the word, and we're here for you. And thanks for joining us.